Mr. Stanton.
Yes.
My name is Gabrielle. I'm a physician assistant student. Do you mind if I take care of you today?
Yes.
All right. Nice to meet you. Can you tell me your name and date of birth?
Arnold Stanton, February 27th, 1970.
Thank you. So what brings you in today?
I just have this really bad headache and a stuffed nose.
Okay. When did this start?
Well, I had a cold a few weeks ago. Then the cold went away about a week ago, and it turned into this bad headache.
Can you show me the location of the headache?
Yeah, it's on my right side here,
Okay.
and it kind of goes to my forehead, and I feel it in my eyes, too.
Okay. And it's been constant for this whole week?
Yeah, it's been constant. It really doesn't, get any worse or better.
Okay. Can you describe the pain that you're feeling for me?
It's just a really tight feeling, like somebody's, compressing on my head.
Okay. Kind of like they got a rubber band and they're just tightening in on your head?
Exactly.
Okay. And you said you have a little bit of a stuffy nose still.
Mm-hmm.
Can you describe that for me?
I would just say it's normal congestion.
Okay.
There's really nothing more to that.
Kind of residual from your cold.
Mm-hmm.
Okay. And then we said that the headache radiates to the center.
Mm-hmm.
Okay. And a little bit in your vision area.
Yeah, that's
Okay.
my eyes. Mm-hmm.
Okay. And then we said it started a week ago. It's been pretty consistent the whole time. With
Mhm.
this pain, how would you rate that on severity from 0 to 10?
I would say it's like a 6.
Okay. And it stays about a 6 the whole time?
Mm-hmm.
Alrighty. Does anything make it better, or has anything been helpful?
No, nothing's really made it better.
Okay. Has anything made it worse?
Yeah, I did try taking some Allegra,
Okay.
and I got really dizzy and my balance kind of got lost.
Okay. Do you have any associated symptoms, like any fatigue or fevers, anything like that?
Yeah, so I have had the dizziness, and I've had some ear popping, and I feel like the ear on the side of my headache, I don't hear as well right now.
Okay, so kind of some hearing loss that we're on this right side?
Mm-hmm.
Okay. And then do you mind if I ask you some of your past medical history?
Sure.
Okay. Do you have any childhood illnesses that you remember? Or
No.
conditions?
Mm-mm.
Any conditions that you're currently dealing with?
Yeah, I have some chronic low back pain that I've been dealing with for a long while, and I also have high blood pressure.
Okay. And have you had any surgeries?
I have had a couple surgeries. I had tonsillitis,
Okay.
and I also had a laminectomy for my back pain, so they took out L4 and L5.
Okay.
And I also had a lower leg vein stripping procedure.
Alrighty. And did you have to stay overnight for any of these procedures?
No.
Okay. You said that you have hypertension. Are you taking any medications for that?
Yes, I take lisinopril 20 milligrams every day.
Okay. Thank you. Do you take any other medications?
No.
Okay. Do you have any allergies to any medications or anything?
I do have allergies to penicillin, aspirin, and dust mites.
Okay, thank you. I'm going to ask you a little bit about your health maintenance. So are you up to date on your flu shot, tetanus, meningitis, rubella, all those vaccinations?
I'm up to date on my vaccinations.
Okay. And you're getting about the age to have a colonoscopy. Is that something you considered scheduling?
It is. I haven't had one yet, but I am considering scheduling it.
Okay, awesome. Can you tell me a little bit about where you work and where you live, kind of your
Yeah.
lifestyle?
I'm an electrician, and I'm divorced, and I live in the area.
Okay. All right, thank you. Do you have any use of tobacco, like current or prior?
So I did, at a young age, start smoking for about 30 years.
Okay.
Then for 10 years I quit, but now I'm back to smoking.
Okay. How often are you smoking?
I smoke every day, about a pack a day.
Okay. Do you have any, or have you used alcohol, or is that something you regularly do, once a month? How does that for you?
I drink about a beer a day.
Okay. All right. And do you use any illicit drugs or marijuana or anything
No,
like
none
that?
of that.
Okay. Have you traveled outside the United States?
Not recently.
Okay.
No.
Sorry, I was gonna ask about your family history. Do you have any history of hypertension, migraines, diabetes, anything like that in your family history?
No, that runs in my family.
Okay. I'm going to ask you a few more questions just about some of the symptoms that you mentioned.
Hmm.
So, you said you feel fatigued, but have you had any fevers or chills, anything like that?
No.
No. Okay, so just the fatigue and the dizziness.
Yes.
Okay. And then, so we talked about that the pain is kind of moving to your eyes. Is that changing your vision at all?
No, it just hurts in my eyes. No change in vision.
Okay, just as a pain.
Hmm.
Okay. Have you had any sore throat, bloody nose, anything like that?
No.
Okay. And you said that you have some hearing loss on the right side.
Yes.
Any other ear pain associated with that?
No.
Okay. And with your respiratory, do you feel any, when you're congested, does it feel short of breath? Does it like feel sharp?
No,
Anything like that?
no real changes in breathing.
Okay. Does your neck feel swollen or stiff?
No.
Okay. And heart-wise, do you feel any tightness in your chest or palpitations, like your heart is racing?
No chest pain or palpitations or anything like that.
Okay. And have you had any changes in focusing or memory, anything like that?
I've been going to work every day, and well, it's been tough to concentrate. Nothing out of the ordinary.
Okay. All right. Well, I'm going to talk with the collaborating physician, and I will get back to you.
Thank you.
Okay. Thank you. Arnold Stanton Jr. is a 49-year-old male that works as an electrician. Today he presents with a headache and slight nasal congestion that has lasted about a week. He has a past and current medical history of hypertension and chronic low back pain. The headache that he presents today with, it started a week ago when he finished up with a cold he had been dealing with for a while. It's on the right side of his head in the temporal region and radiates across the forehead and the orbital area, especially on the right side. He describes it as a tightening feeling, like someone has a rubber band around his head, and it has not waxed or waned in this duration of a week in the pressure that he has been feeling. He has taken Tylenol, ibuprofen, nasal sprays, and Allegra, and none of those have alleviated his symptoms, although he has not found anything that has aggravated his symptoms. An associated symptom that he has felt is dizziness that was especially accentuated with the Allegra, so he stopped taking that. He rates the pain as a 6 out of 10 in severity and says that the timing has not changed when it is a 6 out of 10. It has been consistently a 6 out of 10. He denies a family history of hypertension, diabetes, or migraines. He is on lisinopril to manage his hypertension, and he has allergies to aspirin, penicillin, and dust mites, which all cause a respiratory discomfort. He is a 1-pack-a-day smoker and smoked for 30 years prior to taking a 10-year break that has now ended with him smoking again. He drinks 1 to 2 beers every day and denies any illicit drug use or use of marijuana. He denies any fevers, chills, changes in breathing rate, or heart palpitations, chest tightening or chest pain, difficulty sleeping, changes in memory, or changes in vision.